I choose Height Increase Info because everything was involved in a single package. Every 15 to 20 days, my X-ray was done.
Okay, so what is your overall experience with Height Increase Info? What do you say? Are you satisfied?
Yeah, it is a life-changing.
And again, inside. This leg also has same scars. Hello, I'm Dr. Hirdesh from Height Increase Info. So we are here with one more success story of 7.2 centimeter. He lengthened tibia 7.2 centimeter and his frame removed around 2 months back. 2 months back. His starting height was 161 and now he's
168.2.
161, now 168.2. So we will know his entire journey from starting to end.
My surgery, frame insertion surgery, was performed on 13th of June 2023 and my frame is removed on 7th of October 2023 and overall I have achieved 7.2 centimeters bilateral tibia and right now I am on recovery phase. Major portion of my recovery is completed. Right now I am walking with the help of crutches and within 1 month I will be independently walking without the crutches and my journey so far was very good and the experience at the hospital and at the guest house and the rehabilitation center was very satisfying. I was able to achieve the target. My target was to reach somewhere around 7.5 centimeter and I was able to achieve target very near to my goal and I want to thank Height Increase Info, Dr. Hirdesh sir and all the physiotherapists who helped me achieving this target and who helped me in the rehabilitation and who helped me in getting back to my normal life.
Great. So what was your experience with frame? You were in frame in almost 3.5 months, huh?
Yeah, around 3.5 to 4 months I was in the frame. Initially I was having much trouble with sleeping the frame because my tendency to sleep was on chest. I used to lay down on my chest and sleep like that only. But after frame removal it was not possible to sleep on chest. I have to lie down straight on my back and that causes a lot of discomfort. In my case, not in everybody's case, in my case it was causing a lot of discomfort and I initially for the first 2 months I had faced problem related to sleep. I couldn't sleep. Then after 1 or 2 months my body adjusted and I took some meditation related to sleep and after that I was able to sleep 4 to 5 hours. But when the frame is removed then it was completely the sleep was like in my normal routine. I was able to take sleep of 6 to 8 hours daily and right now I am taking proper sleep and no problem with my sleep right now.
How do you manage your daily activities with frame? Is that very difficult and is it manageable?
It is all manageable. Nothing was very complicated. Nothing was like that you cannot handle. And in my case, I didn't face any major pain. Only the pain related to pin cuttings and some pain related to muscle stiffness I faced. That too also after 5 centimeters. When I crossed 5 centimeters, I started getting pin cutting and some muscle stiffness and those pain I have to bear. And these pains were manageable using the painkillers prescribed by sir and also whenever I get some sort of inflammation at the pin site, sir used to recommend me some antibiotics that helped me in coping up with those inflammation also. And regarding food and nutrition, we were provided 3 times meal at the guest house based on our nutritional requirement. Apart from that, we were taking nutritional supplements like which will increase the bone density and bone formation of the body and also the skin condition of the body because the skin of the shin bone also stretches. So all those were the part of the journey.
Okay, patient asked this thing now. When patient comes, sir, do you provide individual surgery? Means we don't want to stay in guest house. Means they want to do everything, all care by themselves at home after the surgery. Even some surgeons also saying, come here, we will do surgery and you can take care at home. Is that possible? I'm just asking you because you were in that situation.
Honestly telling, from my experience, if I wasn't shifted to the guest house, I won't be able to achieve the target and I won't be able to manage all the pain and complications which are the part of the journey, which are the part of the surgery. I also consulted few of the doctors before this surgery. One of the very prominent doctor in my hometown, he also do surgery, but he sent home the patient. He used to send home after the surgery. But seriously, this is a very complicated surgery which needed a lot of care and observe under the expert. start, and the major part of the journey start after the surgery only, because there is physiotherapy, there are pain management, there are expert guidance, because often the time there are some problem, like I told I face some inflammation at the pin site. I was very scared that what's happening at my pin site. Then sir came and told no, it is just screen irritation and some sort of inflammation. So if I been there in house in same situation, I would be very scared and I won't be able to achieve the target. And also there are a lot of complication involved in the surgery. Complications like ballerina, FFD and muscle stiffness, pin cutting. So all these things are manageable in a guest house under some experts guidance. So I don't know how people accept that after surgery they can go home and they can perform all their activities. If somebody asks my opinion, I think that staying at a rehabilitation center under experts guidance and observation and under experts care is the most important part of this journey. And I won't recommend anybody going home after the surgery. I would recommend that you perform surgery and you choose a very good rehabilitation center where they provide you physiotherapy and for nutrition as well as all the medical care related to the surgery.
Okay, so if patient want to do this surgery, you want to give any suggestion to them how to prepare for the surgery in terms of mental, physical and other preparation also what you did?
Okay, if I were to tell somebody that how to prepare for that surgery, I will tell how I prepared myself for the surgery. Number one thing, you prepare mentally, because it's a long process. It is 4 to 6 month long process. So do not consider a short period. Do not think that it will be completed in 1 or 2 or 3 months. Please prepare your mind that can take from 4 to 6 months, and prepare yourself mentally. Don't break down. Don't have any other major plan like wedding or wedding yourself or something like that. Number two, the stretching exercises prescribed by sir. Do all the stretching exercises and all the necessary dieting, like don't smoke, don't take alcohol 1 or 2 months before performing the surgery. Sir's video is very helpful, in which he demonstrated all the stretching exercises which will stretch all the muscles. If you are planning for tibia, then go for all the calf stretch exercises, and if you are planning for femur, go all the adductor and ductor muscle exercises. And go to the rehabilitation center, meet the patients live, meet the physiotherapist, meet the rehabilitation expert. They will guide you, they will suggest you which segment is better for you, how much time it will take, and what is the maximum length you can achieve. So this is my advice, this is my recommendation to the viewers.
Okay, so what is your overall experience with height increase info? What do you say? Are you satisfied?
Yeah, it is a life-changing, I want to say, because growing tall was one of my major dream, which was fulfilled here at Height Increase Info. And I was having so many doubts in my mind that whether I should go for this surgery or not, or is this safe for me. But thanks to Hirdesh sir and all the physiotherapists, they guided me throughout the way. Whenever I felt any sort of doubt, they clear all my doubt and also recommended me all the best practices involved in this surgery. And the special part was that there is one dedicated gym and rehabilitation facility at Height Increase Info. It helped me a lot, because staying fit throughout the journey is very important, because your body is undergoing so many changes. Your bone is expanding, your skin is expanding, your muscles are increasing, your nerves are under stretch. So staying fit is very important part of this journey. At Height Increase Info, we have a dedicated gym. I used to go gym daily, and we have all the machines and all the machines related to upper body strengthening as well as lower body strengthening. And also we have machines related to the callus formation. We have a machine called PMS, which helps in boosting the callus on the gap which is created by the journey, by the lengthening of the bone. And also we have some other machines like a muscle stimulator and Takar machine.
Takar, US, muscle stimulator and few other modalities also.
A few other machines which help coping up with pain management and also the regeneration of the bone. And I choose Height Increase Info because everything was involved in a single package. I didn't have to go anywhere. I just came here. They took me to the hospital. My surgery was performed, and then from hospital to guest house, they only took me, and I stayed in the guest house. Every 15 to 20 days, my X-ray was done by the Height Increase Info team, and my lengthening was monitored by the Height Increase Info. And every 15 to 20 days, my X-ray was monitored, my lengthening was monitored by the team. And these all things I asked beforehand before performing of the surgery, I cleared all my doubt, and that's the reason I chose Height Increase Info. And if somebody is planning for limb lengthening surgery, my recommendation would be also Height Increase Info.
So this is his review, but he is in under process right now. His callus is not fully joined, but growing. It's good formation.
In one leg it is good, in one leg it is lagging behind.
Lagging behind, yeah. So he is walking with
Crutches.
elbow crutches. Maybe very soon, within 1 month, he can walk without any aid, without any assistance. Maybe we will post his final video once he can walk. We can do all activities once you reach your normal height, normal activities. So thank you. And see scar condition after almost 5 months. This is where nail inserted, pin cutting scar, and this is almost gone. Osteotomy scar, nail screw, and again pin side. This leg also has same scars.